about how best to launch healthcare programs in poor communities. So please join me in welcoming our commencement speaker, Dr. Yong Kim.
Thank you very much, Dean Wing. Walking down today, I had just intense memories of doing the same thing in 1982. And I remember how important the day was for my parents. So I want to start by thanking the parents and congratulating all of you. My wife and I have two sons, an 8-year-old and a newborn just 3 months old. And in my sleepless haze, I truly can't imagine what a thrill it must be for you to marvel in the wonderful fruits of your labors as parents. I can't see beyond trying to get through tomorrow night with our 3-month-old. You know, the day you become a physician is a day that you don't soon forget. The day I graduated was a brilliant sunny day, and the featured speaker was one of my beloved professors who gave a very forgettable speech, which I indeed have forgotten completely. I doubt that any of you will remember what I'm about to say, but with great humility, I want to give you a few pieces of my story, and then talk about what it is that physicians might do in this very complicated world. This is obvious from my appearance. I grew up in a small farming town in Iowa. According to my mother, who is a philosopher of Korean Neo-Confucianism and alert to these kinds of tendencies in her children, as young as 8 or 9 years old, I was transfixed by images of Martin Luther King and the Vietnam War. On one especially sassy moment in my young life, my mother tells me that I admonished her for not participating in the social movements of the time. "Mom," I said, "why aren't you out there protesting for civil rights and against the Vietnam War?" To which she looked at me and said, "Because I'm here making your dinner and picking up your socks." When I was 12, I was one of about 3 people in Iowa who campaigned for George McGovern in the presidential race. He lost in every state except Massachusetts. And despite those early failures, politics and social justice has endured as a strong passion for me. My years here at Brown were the defining experience of my life. I'll never forget the day I returned home from my first semester at Brown. My father picked me up at the airport, and as he was driving home, he asked me what I was going to choose as my major. Buoyed by an exhilarating term during which I'd taken what he called non-science courses, I announced to my very practical Korean dentist father that I was going to study philosophy and political science. At that point, he slowly pulled the car over to the side of the road, looked back at me and said, "Yeah," and he said some things in Korean which I won't repeat. "When you finish your residency, you can do anything you want." I spent the rest of my days at Brown bouncing back and forth between the Third World Center, where along with African American and Latino students, I helped to plot building takeovers and mass demonstrations. This was a blast, by the way. But if there are any Dartmouth students in the audience, I want them to know that they shouldn't try that in Hanover. It's not necessary anymore, guys. And I also spent a lot of time in the science library studying with my broad coterie of nerd friends. When I went to medical school, I had the good fortune to be part of the first cadre of students to receive an MD and a PhD in the social sciences at Harvard. Thankfully, since I was going to receive the MD as well, my father tolerated this slightly worrisome diversion from the path he'd chosen for me. And after completing my dissertation research in Korea, my father passed away. And at that point, having to figure out what I was going to do for the rest of my life, I began working with Paul Farmer and Ophelia Dahl, who've been my life partners in this work on health and social justice. In 1994, we started working in Peru with very modest aspirations. We were just going to start a small program to try to care for a very poor community in the northern cone of Lima. But we found patients who were sick with tuberculosis, despite the fact that they were living in what was the best tuberculosis control program in the world in a developing country. We thought that they had drug resistance. But at that time, the World Health Organization told us in very clear terms, you are not to treat the patients. If you do treat the patients, in fact, we were told, that not only would we not let you do it, but we'll kick you out of the country. So, of course, we started treating the patients. And we've had some great successes. We were able to have great clinical outcomes. We worked with a lot of other groups to lower the price of drugs. We were able to find a donor who would fund the treatment of drug-resistant tuberculosis patients. And in about 5 years, the World Health Organization lifted the death sentence from people living in poor countries with drug-resistant tuberculosis. Just a few years after that, we started treating patients with HIV in Haiti, at a time when the only poor people in the world who were getting treatment for HIV were in Brazil. 1996 was the year that we discovered highly active antiretroviral therapy that literally turned what was thought to be a uniform death sentence into a chronic disease, a chronic manageable disease. Treatment efforts went very well in Haiti, but we were told that we were crazy. We were told that it was not cost effective. We were told, once again, that if we treated the patients, we'd be in trouble. Who knew that you could get in trouble for treating a patient? Despite the transformative impact that the treatment was having in rich countries, as late as 2002, there were 20 to 25 million people sick in poor countries with HIV, and the consensus in the policy world in 2002 was, I'm sorry, they're just going to have to die. In 2003, my good friend, Dr. Jong Lee, was elected Director General of the World Health Organization. I helped to run his campaign, and so when he won, he called me and said he wanted me to come to, quote unquote, help him run the World Health Organization. So we sold our house in Boston, loaded up the truck, and moved the whole family to Geneva, kind of a Korean-American version of the Beverly Hillbillies. And let me say, most Americans love Geneva, but for us, it was a tough transition. Geneva is extremely expensive, has terrible Korean and Chinese food, and it's not very friendly. It's actually against the law to mow your lawn on Sundays. And there was a written ordinance that stated that in apartment buildings, it's forbidden to flush the toilets after 10 p.m. So for about the first month, every night at 10:05, we flushed our toilets just to see what would happen. Well, despite the challenges of Geneva, we stayed for almost 3 years, and we launched the 3x5 initiative. When we started in 2003, there were almost nobody on treatment for HIV, and we set the outrageous goal of, in the next 2.5 years, going from about 50,000 patients on treatment in Africa to close to 3 million throughout the world. Most people say that 3x5 was one of the most ambitious, and even more people say the most insane campaign WHO ever initiated. It caused a huge amount of controversy. By counting the numbers on treatment, though, and announcing them every 6 months to put pressure on countries to do more, WHO played an important role in lifting another death sentence on people living in poor countries with HIV. Happily, we reached 3 million on treatment by the end of 2007. Missing the target by 2 years, by the way, turns out it's the best WHO has ever done on any target it has ever set. But in returning to Harvard from WHO, I was struck by how much the world had changed in the 2 decades since we'd started Partners in Health. From a time when there was very little interest, there were 2 students in my class, graduating class at Harvard, who were interested in global health. And when there was almost no money, by 2006, some 25 to sometimes 50% of graduating medical school classes at least had an interest in global health, and we were spending $10 billion a year just on HIV. So in a real sense, for those of us who've been yapping away for years that we needed more money and attention to global health, it was as if the dog had caught the car. Now what do we do? For the last 3 years, I've been obsessed with trying to figure out how we can be better about executing around our most cherished social goals. You know, it seems to me at times that those of us who are on the side of accomplishing social goals like healthcare, health, higher education, social protection, even environmental sustainability, it seems that it's enough for us to stand up and just declare that we're on the right side, and it's okay to execute like crap. How many of you have known NGOs that have the most wonderful intentions but never execute around those intentions? So I started hanging around at Harvard Business School with my now very close friend Michael Porter, and at MIT with systems engineers, because I thought they might have a better idea about how one can execute around complex goals. Now, most of the work that they do was around for-profit initiatives, but it turned out to be one of the most stimulating intellectual experiences of my life, and that's why I'm going to Dartmouth. I think that we who are standing for social goals and try to stand for social goals, like everybody that's graduating in this room today, have to think hard about what it means to now actually execute around them. Our healthcare system is twice the cost of any healthcare system in Europe, and we get worse outcomes. Peter Orszag, the current director of the White House Budget Office, has said over the long run, the deficit impact of every other fiscal policy variable is swamped by the impact of healthcare costs. In other words, as physicians, no matter what specialty you choose, whether you become primarily a clinician, researcher, policymaker, or something else, our failure to execute around the cherished social goal of better health will be your problem. And it will be the problem, as Peter Orszag says, for any government that's trying to meet its most cherished social goals. One of my predecessors at Dartmouth, John Sloan Dickey, was fond of saying to his students, "The world's troubles are your troubles, but I haven't seen a single problem that can't be solved by better human beings." I've been asked to take the presidency of a great institution of higher education to see if we can't produce better human beings who will be more effective at thinking about and executing around a wide variety of goals, from working in the business world to scholarship to solving the problem of healthcare, both here in the U.S. and abroad. It's the greatest privilege of my life, yet it was not a position that I had been preparing for at all. Indeed, one of the members of the board, who many thought would not support my candidacy, told me, "I voted for you because it was clear to me that you wanted to do something, not be something." What can you do? Well, you've already done so much to get here today. Take this day and the next few weeks to celebrate and prepare yourself for those long call nights that are soon to come. But let me leave you with just 3 quick final thoughts. The first is that you must find your passion, a passion that is built on the foundation of your most cherished values. For me, that passion has been fighting directly for better health and health care for the poorest people in some of the poorest countries in the world. Now I've chosen to throw all my energies to preparing others to tackle these problems with far more skill and expertise than I could ever offer myself. But there are many ways to make the world a better place. I've been asked on several occasions by students and young physicians, what should I do if I want to follow in your career path? And my answer is always the same. Find your passion. Whether you work in global health, and I dearly hope that many of you will, or focus exclusively on research, clinical services, or any other thing that you choose, the most important thing for all of you is to find that line of work in which you wake up every morning excited about your day, unable to believe that you actually get paid for doing what you do. Live out your values and find your passion. You've worked hard, and you deserve it. Second, and at the risk of sounding like a middle-aged Asian father, which I guess I am now, listen carefully to your parents and all those who love you enough to tell you the truth. They know things about you that you might not like to admit to yourself, but that you need to know. If I hadn't listened to my father, instead of being in here talking to you, you might have passed me out in Providence somewhere, standing on a milk crate, urging you to care about Darfur or some such thing, which is a great thing. Finally, think really big and never stop believing that you can and indeed must change the world. Every time we've tried to do something like lift a death sentence from the poor, or death sentence on the poor from drug-resistant TB or HIV, the people who fought hardest against us were our own colleagues. It's too difficult. It's too expensive. Focus on the simple things. This was the chorus of the naysayers who just didn't believe it could be done. You will face this can't-do attitude as you enter your training, and I implore you, especially when it comes to advocating for your patients who are both sick and poor, don't give in. Once I found myself in a heated discussion with Tracy Kidder, the great writer who wrote about my colleague Paul Farmer. As usual, I was making some grand statement about what we might be able to do if we just had a little more money and a little more time. He was being very negative, but as he often does, he caught himself and said to me, Well, as they say, cynicism is the last refuge of the coward. So let me shut up and I'll watch as you go out and take this on. You'll find cynicism everywhere as you go forward, not least of which in the hospitals. But don't give in to the fear. Fearlessness in the face of the suffering of others is what you've been taught here in this great medical school, and it will serve you well for the rest of your life. I leave you with the words of a member of my tribe of anthropologists, Margaret Mead, who said, "Never doubt the ability of a small group of committed souls to change the world. Indeed, it's the only thing that ever has." Congratulations to you, to your parents, and to the entire faculty.